Hello everyone, welcome to the Heroes Initiative powered by IPCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by IPCA. So doctor, now we are focusing on cataract surgery pre and post-operative care. So doctor, my first question for you is, what should I expect during the pre-operative assessment for cataract surgery? Are there any specific preparation do I need to make, doctor?
See, first, once the patient comes for checkup, once we diagnose that he or she has cataract, then our main motto is that we have to go for surgery. But before surgery, we have to look after many things. Number one, if the patient has dry eye, the dry eye condition usually worsen after doing the cataract surgery. So we have to ask the patient and we have to warn that your dry eye condition should be simultaneously treated also. Number one. Number two, the ocular rhexacia, if there is a slight sort of infection is there, definitely we have to control that infection. Then only after that we can go for surgery. And most importantly, the diabetes and pressure and high pressure and many other systemic diseases, if they have to be treated early, then only we can go for surgery. So this, once they have all these conditions fulfilled, then only we should go for surgery. And before surgery, usually, if we are doing a planned cataract surgery operation, usually we are installing antibiotic drops 1 day before the surgery, so that hold the eye and conjunctival check and other things are infection free. Then we'll go for operation. Nowadays, the operation becomes very easy in the sense that it is done on topical anesthesia. We are not using any injection. We are not using any patch. We are not using anything. The patient can come and go home, and they become very happy after operation. So, but only thing is that we need to have the thorough pre-operative checkup such that patient will be happy post-operative.
What are the most important post-operative care steps to ensure a smooth recovery after cataract surgery, doctor?
See, I told you that surgery becomes very easy nowadays. But the other environment and cleanliness and hygiene is most important for a successful cataract surgical outcome. So after COVID, we are more sensitive for the sanitization and sterilization procedures. We ask all the patients to whom we are doing the surgeries that keep your hands clean all the time. Keep your hands clean and wash it with soap water and if possible sanitizer all the time. Then only you should touch your eyes or anything. And while instilling the drop, the attendant or patient, they should wash their hand so that they install the drop regularly. They should not go out very frequently so that they are free from infection until we advise. So if they follow the proper hygiene and the other things, then patient outcome is not a concern for us.
Are there any common complications after cataract surgery and how they can be managed or prevented?
See, there are hundreds of complications in relation with cataract surgery, but fortunately, and because the surgery is done through a very small hole, that is the phacoemulsification, now the complication rate has drastically comes down. So initially, patient may have pain or may have blood at the anterior chamber, but that is transitory. The patient that will go off. Only thing is that we warn the patient if they have anything like patient has sudden drop down of vision, sudden pain, then they have to inform the doctor as early as possible and come for checkup. And nowadays the endophthalmitis, that is the infection of the eye, has drastically come down because of very good pre-operative, intraoperative and post-operative care. So even the percentage, though it is very less, even then we are very concerned about the causes of endophthalmitis. And basic causes are the infection that is usually produced by the patient itself. Sometimes even pre-existing infection might be there. So we have to be very careful for that.
So, doctor, your expertise and insights on cataract surgery pre and post operative care are invaluable to this initiative, and we believe your participation will greatly benefit the patients.